Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
United Nations sharing and about liver transplants and some people dying, waiting, and how they're going to revamp the whole system. We've heard a lot of talk about that, so it's going to be interesting to see what happens over the next couple of days and weeks in terms of. I don't know how many of you read the articles, but there's been a lot of talk about people who live not in New York or California, but right in the middle of the country, like Kansas and Midwest, who are dying on the waiting list. Of course, 17 people die every day because of the shortage of donors, but especially people who need liver and heart transplants. Because for kidney transplants, you at least have dialysis, but for the liver and heart, of course, for the heart, you do have the artificial heart. But for the lungs and the liver, we don't really have a good substitute. So many people blame the lack of receiving organs on the system. The real issue is the shortage of donors, but we failing at that, we now are saying it's the system that's the problem. So it's going to be interesting to see how the politics and everything else enters into the way of solving this problem, when in point of fact, the real problem is the shortage of donors. And it's going to take xenotransplantation and stem cell transplantation to really help us solve the real problem, which is the shortage of donors. Any thoughts or ideas about this? Is this all political, or what are your thoughts? Or do you have any?
Dr. Callender, I remember back in the day when Sonny Jurgensen had two different transplants and he never stopped drinking. And it
Mickey
was
Mantle.
Oh, it was Mickey Mantle. I thought it was Sonny Jurgensen, the
Mickey
football
Mantle.
player.
Oh, football player. Well, I know Mickey Mantle was the baseball player who got a liver transplant, and but I don't know about Sonny Jurgensen.
I think Sonny went through two different organs.
Yeah. Okay. Well,
we'd have thought it would have been Billy Kilmer.
Yeah. So anyway, so nobody has a comment. So John, I guess we can start showing the.
Yeah, one comment I was going to make was that if they do partial liver, that would seem.
They have been doing partial livers.
Yeah, and so that would tell me that it's not so political.
It's not what?
It's not so political.
Oh, well, they've been doing partial liver transplants for at least the last 10 years. But
how does it become political?
Well, it becomes political in the sense that the people who complain the loudest and make the most noise get the system changed. And we focus not so much on the real problem, which is the shortage of donors, but on this system that's trying to match donors with recipients. And so so I consider some of it as being well meant. I think it's all well meant, but I think a lot of it is political. I don't know who's behind it or why, but anyway, the system, the issue is the people who are in the Midwest who are not getting the organs, and people in places like New York and California who are getting the organs. And so the question is it really the system, or is it really the shortage of donors?
Okay,
Mhm.
in the Midwest, is it because they have lack of hospitals or facilities? And where the larger metropolitan places are, they have more facilities?
Yeah, that's right. Yeah, and that's part of the problem. Like in Kansas, there's only one liver transplant center, and so and it's harder for the patients in Kansas who are in the rural area to actually get to where the hospital is. So it becomes a situation that involves many things, not just one thing, but the overriding issue that is not so much the system as it is the shortage of donors, which is the real problem.
What's the process for a partial liver transplant?
Well, that's that. Well, that what happens, for example, a mother can give a part of her liver to her daughter or son, or when you die and your liver is used, you can divide it into two and give two people livers rather than one. So that's the system that they're using now. For example, we have a video that we're working on now that's coming out that talks about this young lady who's now actually a college student who got a transplant from her mother, who gave part of her liver to her, that resulted in her life being saved. And so partial liver transplant is something that has revolutionized transplantation in the sense that out of one person who dies, you can get two livers, or a person who's a live donor can give part of their liver to somebody else.
Mhm.
Um,
Dr. Callender, I was wondering what happens to the donor and the recipient with the space involved? Because if you give a partial, you have a gap in your body. And
Well,
if
the
you
liver
receive
grows. The liver grows and fills the space.
wow,
Yeah,
never knew.
yeah. The liver is the only organ that we know of that it is regenerates itself.
Whoa.
And it doesn't take that long for it to grow, right?
About 6 months.
Wow.
Amazing.
back to the area hospitals. How many hospitals in this area alone do transplants?
It depends what you're talking about, kidneys or livers, because there's about George Washington, Walter Reed, Virginia, Georgetown are do transplants. George Washington does pancreas, liver, and kidney. Georgetown does pancreas, liver, kidney. Walter Reed does liver and kidney, and Fairfax does liver and kidney, I believe. So those are ones locally.
Then you have Hopkins.
That's not local.
That's
That's
close
Maryland.
enough for me.
I know, but it's not local. That's all. Yeah, Hopkins, of course, and Maryland, but those are that's both of them. Yeah.
Okay.
Dr. Callender, I didn't realize how lucky we were in this area until I started traveling, and I found out how far away people are from doctors and hospitals. And I have a friend that lives in the South, and they were all getting excited and happy that they were going to have a hospital that was 40 miles away.
Whoa.
Before then, the only hospital they had was 75 miles away.
Yeah, yeah. The rural situation is, and that's part of what this situation is about relative to the liver transplant. It's the rural area is victimized over the urban areas, and that's part of a major part of the problem as well.
Mhm.
Is this area the most densely populated as far as hospitals, or which area has the most hospitals?
I would think New York does, but
Oh, okay.
Dr. Callender, we have a new visitor, Pam Ridinger, were invited as well to come.
wonderful. Is she gonna tell us something about herself?
There she is. Hi, Pam.
Hi, Pam. Welcome. Thank you for joining us this morning.
Thank you for inviting me, John. Trying to get my
Yeah, Pam, your sound is breaking up real bad.
better now.
No, you might have to turn your video off. Try that. Try it now. It's still
No.
breaking up. Maybe you should just listen today.
There's a log in and out of a different device.
Okay.
Well, we're thrilled to have you join us today. Okay, I guess we can start our first graphic. Yeah, this is an interesting article about the fact that partially because of COVID and partially because of the other big elephant that's with us, which is the opioid crisis, life expectancy has dropped. As you can see by this, that we hit our high for us, which is 79, and but now we dropped down to 76 in 2021, and it's thought to be related to. It's interesting because heart disease remaining the same, cancers going down some, but COVID and opioid overdose remain the big problem. Heart disease still is number one, cancers two, and then COVID. But most of the decline in life expectancy is related to those three. Overdose, a third of all deaths from accidents was opioids. So that's a real crisis that we have not yet learned how to deal with. So as a consequence, our people are dying younger than ever before. And of course, we didn't have the highest longevity anyway. And of course, we had more than a million people die from COVID in the last 3 years. So that didn't help us at all. But the fact is that our life expectancy is dropping. And so the question is, what can we do to, of course, opioid crisis is not changing. The rate is still going up. Liver disease still remains one of the top causes. And as we know that the hepatitis C, certainly that helped, but people are still drinking a lot more alcohol, and alcoholic cirrhosis is still one of the top killers of causes of liver failure and the need for transplant.
And it's really scary. Every day in the news, we hear about drug overdoses of teens. It's in the schools.
Yeah, and under teens.
Yeah.
Yeah.
Younger and younger. Yeah. Scary.
It is scary. And
What about gun violence?
gun violence is still there. It's just that the others have overtaken it. Overdose, as you see here, is 1/3 of all the deaths.
Wow.
It's quintuplet. It's 5 times what it was before. So gun violence remains a problem, but it's not the same magnitude as opioid and COVID. Access to naloxone is something that has been introduced, so anybody can get it. All you have to do is go to the pharmacy and ask for it. But
Not if you've overdosed.
sorry,
Not if you've overdosed. Can you walk into CVS and get some?
Too late.
Yep.
yeah. But and the expectation is that those of us who are okay will find somebody who is not okay and get them to breathe in the naloxone and get them to wake up. Heart disease is still there. High blood pressure, cholesterol, diabetes, and NASH, non-alcohol, non-alcoholic fatty disease, fatty liver disease is still a problem. Then, of course, diabetes remains an issue. High blood pressure, high cholesterol. With COVID, of course, the misinformation has been a problem. Hopefully, we have now overcome that. It's gone from pandemic to endemic, and we have vaccines. So this is now a reason why people aren't wearing masks anymore. And when I say people aren't, because some places still you wear masks when you go to the basketball games. There's nobody. Only people who wear masks are the ushers and people like me.
Me too.
Three.
Cancer remains prevalent, although the prostate cancer and colon cancer and breast cancer are at the top. But the death rate from cancers have decreased, but screenings have dropped off because of the pandemic. And so trying to get people to get the mammograms and lung cancer screening and prostate screening has become harder to come by. But I think what we have to do is a real information blast, reminding people to get their mammograms and colonoscopy because we want to change that downward trend of life expectancy. I think many of us are still going to the doctors, but there are a lot of people that have put aside their going to doctors because of the pandemic. Any other comments or any other thoughts about anything else we can do? Okay.
Dr. Callender, my sister had a visiting doctor, and I thought that had gone out of style, but he came to see her, but he doesn't have privileges at any hospital. That's weird.
Yeah, well, remember the day when doctors visiting houses was common. Now
Yeah.
it's a rarity.
There's a program at Washington Hospital Center that I had my parents in, and it was the geriatric practice, and they come to your home, and they were in that care from 2008 all the way to 2018 when my mother passed.
That's great.
Yeah, well, that's good because they're at least coming from a hospital, which means they mostly have privileges at the hospital.
Right.
Take them back. The one that Joyce had, he could just visit and then try to refer her to somebody, but he didn't have any privileges anywhere at any hospital.
That's unfortunate, because if you don't have a primary care doctor, then they just take care of you and dump you. And follow-up is one of the most important parts of
Right.
medical care. Yeah. Okay, let's go to the next one. This is an interesting article that talks about the importance of balancing, and we have mentioned ways to decrease premature death. And this is an article that talks about the fact that if you pass the balance test, you're less likely to die young. And they found that if you stand there counter to balance on your left leg, stand there for 10 seconds, then your likelihood, that means you have better balance and risk of dying is less. Of course, this is all about having strength, being able to stand up and being able to stand on one foot, which is not as easy as you might think unless you try to do it. What this does is reduce the likelihood of falling and you having accidents. And it also suggests that you have the muscular strength to get around. And so this article points out that if you can stand on one leg for 10 seconds, that your risk of dying is decreased.
Dr. Callender, my yoga instructor has us balance on each leg for 20 seconds. And we do the crane pose, like from Karate Kid. And that's that can be challenging. I mean, you could just lift your other leg up a little bit, or you can put it up so your thigh is horizontal. But it's one of the things that we do. And I think Pam is also like a big yoga person, so yeah, she would know about that too. Thanks.
Okay, any other?
Am I doing better? Can you guys see me since I switched devices?
Yes.
Oh, good.
Can hear you much better. Okay. I just thought this was something that was good. And here's another one. Gardening can save your life. We were talked about people shopping, and here's another thing, gardening. It's interesting how they are healthier, they exercise more, eat more fruits and vegetables, and they are likely to live longer. So gardening is something else you may do that is very stress-free and is good for your health. I don't know how many of you garden, but I'm not a gardener. Any of you gardeners?
I just grow kale.
You do? Okay.
Yes, yes, I do.
Okay, all right. Well, it's a good pastime. Just like shopping, and I think this is even more so. Okay. Now, this I thought was a nice little article that talks about the simple things that you can do to get your blood pressure under control. Cardiovascular disease still is the #1 killer of all. And hypertension and diabetes are the biggest villains along those lines. And I think what they mention as #1 to me is one of the most important and simple things to do. And that is to have your own blood pressure apparatus at home and take your blood pressure once or twice a day, and after a while, maybe once or twice a week. And the best blood pressure is the pressure that you take at home. We talk about white coat hypertension, but really taking your pressure at home and recording it and taking that to the doctors is just as good, even better than getting your blood pressure taken at the doctor's office. Then, of course, make appropriate lifestyle changes. And talking about reducing the sugar and salt that you take in, and eating less meat if you eat meat at all, eating more fruits and vegetables, less fried foods, those kinds of things. That's a healthy lifestyle. Healthy food when you can. Uh, uh, and then, of course, we talk about that ad nauseam, maybe. Avoiding unhealthy alcohol use. And any alcohol use is, of course, we know that 1 or 2 drinks a day is good for the digestive system and for the heart. And then one of the things that we found in our screening process is that most of the patients whose blood pressure is high already are on blood pressure medicines, but they don't take them. So the fact that you're on blood pressure medication does not count. It only counts if your blood pressure is normalized. And in order to know that, you need to take your blood pressure at home and make sure. Now, what blood pressure is desirable? There's a lot of debate and discussion about that, but I think as long as you're around 130 or lower, I think you're in good shape. Then your salt consumption, we know that salt is particularly bad for people of color, but it has its issues. But there are some people who actually need salt. If they don't take enough salt, their pressure drops. So, but for most of us, we have to watch our salt intake. And then, of course, number 7 for them is be mindful of your cholesterol. There's certain things you should know about yourself. You should know your cholesterol level. You should know your blood sugar level. You should know your blood pressure. Those are things that you should know. And of course, high cholesterol and high blood pressure run together. And the 2 of them are good reasons for somebody to die early. So it's important to know your blood pressure, know your cholesterol, know your blood sugar. Any comments or questions about those simple steps that you can take to keep your blood pressure under control and actually to live longer?
Dr. Callender, is it possible to do the lifestyle changes and be able to come off of blood pressure medication?
It's possible, but yes, it is. But you just need to monitor yourself and be sure, because many people after they get off the blood pressure medicine, they stop taking their blood pressures. Pam, you had a question.
Can you speak a little bit about the difference between HDL and LDL with the numbers being elevated for
Yes, the LDL is considered to be the bad cholesterol, and you like to have a level of LDL of 100 or lower. Although some people will argue that the cholesterol, the overall cholesterol level should be less than 200, but the LDL in particular, you'd like to be around 100. So that's considered the bad cholesterol, the LDL. The HDL is thought to be the good cholesterol, and you'd like to have that around 40 and above, because that's the cholesterol that dissolves bad cholesterol. It keeps the blood vessels open. And you like to have that above 40. As you get your cholesterol levels, the overall cholesterol level of less than 200 is desirable, but the LDL at 100 or less is most desirable, and the HDL above 40 is most desirable.
Thank you.
Okay.
And Dr. Callender, my primary physician has marked on my visit report that I have is it arteriosclerosis, and that's a reason for having blood pressure medication. I think am I saying that right? Is it atheros?
Arteriosclerosis, yeah, atherosclerosis or arteriosclerosis. But usually your blood pressure is, what is your blood pressure?
That's a good question. I think it's like last time it was 140/70, something like that.
Okay, all right, yeah, because that's considered these days 140 is thought to be high.
Mm-hmm.
So, the question is, what is the cause? Is the high blood pressure the cause of the arteriosclerosis, or the arteriosclerosis the cause of the high blood pressure?
That's
But the goal is to have your blood pressure in the realm of 130 or lower. Oh, in that vicinity. And nowadays 140 is considered hypertension. And so the goal is to keep your blood pressure lower than 140. Any other comments or question about that? Because I think the goal is to really keep the blood pressure normalized, because the data suggests that that is the best way to control arteriosclerosis and hardening of the arteries. And if your blood pressure is normalized, this is very good for you.
Dr. Callender, I can attest to reducing your salt to lower your blood pressure. I tried it and it worked. And every
Doing
time
what?
I start eating less salt consumption,
Oh,
and it helped lower my blood pressure. And so now when I go out to eat, or when I'm eating food, I can automatically taste, the salt content, whether it's too much or whether it's just a little bit or whatever. But I try to avoid all salt.
Mm-hmm.
And it works.
good idea. Good for you.
Yeah.
Go ahead.
Major source of sodium is bread. Bread is loaded with salt, and it also increases blood sugar levels, which puts stress on your blood pressure. And so avoiding bread can really help your weight control and, keep your sodium down. So, I would recommend avoiding bread whenever you can.
Okay. Dr.
Yeah.
Callender, is there a particular time of day that your blood pressure rises or goes down? And
Well, it is thought that the diurnal variations are that at night your blood pressure may be the lowest, and then midday may be the highest.
Okay.
Theoretically, as you sleep, the blood pressure should go down. But of course, we know that some people, when they sleep, the blood pressure does not go down, and therefore, that's why taking blood pressure medicine at night is a good idea. Because for some people, the normal diurnal variation does not occur, and when they sleep, their blood pressure is still high.
Okay. Thank you.
Okay, next. Oh, we got second lab-grown chicken. Now we got meat
How do you
being grown out of the laboratory. What next? But anyway, these now, what is the advantage of these cultivated meats? I think Darryl has made it clear that the processing of the meat is one of the biggest problems with the meat that we have. And so that this meat grown from culture, which has not yet been evaluated, may be safer because of that. But remains to be seen. But because the processing of the meat is one of the biggest problems with the meat, and the way the meats, the way that the animals are fed, and they're given antibiotics and other things that are not good for us. So this is the reason why you have this cultivated meat quest to do away with the ultra processing, which is the main obstacle and the main reason why it is associated with cancer and other unhealthy consequences. So time will tell as we look at, as we get more of this done and as we study it more to find out whether this will make eating meat safer.
Well, you know that you just said that with the processed meat, you won't have all those antibiotics and all those extra added possibilities to it. And the bottom line here, you save a lot of methane that gets put into the atmosphere from animals.
Yeah, of course, the question is when you have new products, what else are they bringing to the table? And of course, that will take time to find out. But it at least will address the ultra processing issue, and as well as the antibiotic issue.
I have a question. John Buchanan, you underlined it could cut down on the 14.5%. What's wrong with gas emissions?
It warms the environment.
Right.
Global warming.
Yeah, and it looks like the ceiling is correcting itself, but it is believed that these emissions are what is knocking out our protective, our protection from outside of the Earth. That is causing the global warming that John is talking about.
Okay, maybe I don't understand it, but from beginning of time, haven't we always had livestock with gas emissions? Or maybe I'm not understanding what this is.
Oh, I think that we may have, but it's getting worse, and it's impacting the lining of the Earth, and so this is the hope that this will. But to answer your question, yes, we've always had that, but that doesn't mean that we can't do what we can to change it.
It's the ozone layer.
Okay, it's a matter of numbers. Currently, there's 8 billion people on Earth. 100 years ago, in 1923, there were 2 billion people on Earth. So
There
we
you go.
have 4 times the number of people with 4 times the number of livestock to feed them. And so you have tremendously more greenhouse gas emissions now than we did 100 years ago. So there's no comparison to the beginning of time.
Oh, okay, thank you.
Okay, next slide, please. Yeah, this is something that we are aware of in hospitals. And there's so many medications, antibiotics, and other medications that have become in short supply that healthcare providers have to substitute many times when they shouldn't have to. And this then is becoming one of the major reasons for accidents. As you know, it is thought that healthcare accidents are second cause of death in United States, and so this drug shortage is not good. But this is a problem that people in the hospital are more aware of than people outside of the hospital. And these drug shortages particularly involve antibiotics, but they involve other issues and other key medications that control the blood pressure and other things, as well as antibiotics. And there's a litany of ways in which this is problematic in terms of causing you to have to stay in the hospital for longer periods of time. Also because, of course, medication errors, which is an enormous problem. How can we overcome this? It's a good question. Some people blame this on the federal government's lack of oversight. I'm not sure who to blame for it, but it is a reality. It's something that needs to be dealt with over time.
Dr. Callender, is that this drug propofol, is that what caused Michael Jackson's death? Anybody know?
No, fentanyl.
No,
Oh,
it was
Michael Jackson. Michael
Michael
Jackson.
Jackson.
Yes. That's the drug. Yeah, that's the anesthetic. But I mean, it's I don't think it's the drug so much as the use of the drug that was the problem for Michael Jackson. Because most people don't require to use a medication like that to go to sleep, and it's an anesthetic. And used properly, it's a good medication. But in his case, it was not properly used. Unlike the fentanyl that's causing the deaths of many of the opioid users. Pam, you had a question?
Dr. Callender, could it be that those medicines, they don't make, the pharmaceutical company doesn't make enough of them because they don't make money on them, and they only want to make medicine that they can make a lot of money on?
I don't know the answer. I don't know the answer to that question. I don't know the answer to that question. Pam, you had a question?
Yeah, I'm just curious, being somebody who is on the transplant list for kidneys, which of those medications, anesthetics, are kidney excreted versus liver excreted? Because I have to be very careful.
What is your question? Which one?
Which anesthetics, like I had to have an endoscopy or a colonoscopy, and I always have to inform the anesthesiologist that I'm an end-stage renal failure, because I was asking which drugs are kidney excreted and which drugs are liver excreted.
Right, and I think that these drug shortages involve a litany of areas. I think more importantly, they involve antibiotics and sometimes steroid drugs. So I don't see that there's a difference between those that are excreted by the liver or the kidney. I think they're general drug shortages. But I think your point is well taken that there are a difference between anesthetics as well as other medications that are excreted by the liver and the kidneys.
Dr. Keller, follow up on that question. The last time I went under, they used propofol. And so obviously that wasn't bad for my kidney and my liver transplant, because That's the one that anesthesiologist chose, so, I guess that was the best one.
It's a good one, yeah. As I said, when used properly, right. So that I wish I could give you a better answer, but I don't know why. I don't know that there's any reason for the drug shortage, except that I know that there is, but I don't know if anybody's systematically analyzed to find out why the drug shortage exists, and because there's so many drugs that are involved.
Yeah, recently they said even asthma medications, there was a shortage. They said that there was a shortage of Buterol, which I needed recently, and I was able to get it. And a couple of weeks ago, they kept advertising, get your medicines. And then they said, if you have a asthma prescription and inhaler that has expired, continue to use it. It's still good. And that's how short it was a couple of weeks ago. And then I didn't hear anything else. So it's up and down. I don't know.
Yeah, but it's serious enough so that it has reached the public domain. It has been in the hospital domain for quite a while.
Mm.
I have a question on the ADHD for children. When did they start using drugs for children that had ADHD?
Probably about 20 years ago.
Okay.
Started. It's just become more popular recently.
So up until then, and children have more allergies now. And I think there's more asthma now. So as our population increases, we're having more problems with things that we did not have. Like, I don't know what they did with children that had that were hyperactive, but they surely didn't give them drugs.
Right.
So maybe they're producing these drugs, and now they got to produce them in mass, because even school teachers and counselors who are not certified are prescribing this and telling parents, you need to put your children on drugs without any medical authorities.
But they cannot prescribe drugs without a license. I don't understand what you're saying.
I don't know, because
ADHD has to be prescribed by a healthcare provider.
right. And I've experienced that. And so that means that you go to your doctor and you say that my child has been diagnosed, or the doctor has to diagnose in order to put your child on those drugs, right?
That's correct.
Okay.
And the doctor has to write the prescription. Or the PA, but it has to be a healthcare provider to write a prescription for ADHD. But they're using it far more than ever before because they're making the diagnosis more often. And hyperactive kids in the past were treated without medication up until recently, where now if you have ADHD, the expectation is that you're going to get treatment for it. I'm sorry, you always got some kind of treatment for it, but you didn't get necessarily medication. Now, if you make the diagnosis, they're more likely to put you on medication.
Like Dr. Robinson said, even in the psychology department, it's easier to give the drugs than it takes too long to try to give therapy to the patient in order to heal, but just to give a drug to either mask it or make it subside.
Unfortunate fact, yeah. Mm-hmm. Okay, let's go to the next one. This is an article about tranquilizers, which have fentanyl mixed with them. And of course, fentanyl has been the deadliest killer we've had. And I think, as somebody mentioned, the age limit for fentanyl dust is getting lower and lower all the time. And
Up and about. Come on,
this
Zoom.
is frightening that
Mhm.
this
Well,
drug fentanyl and its
yeah, you kept me up all
mixtures are so lethal. And it's also fearful that Narcan isn't as effective against the fentanyl mixtures as it is against with the other opioids. So it's what is fearful is that as they mix fentanyl with other products, the risk of death becomes greater and greater. Heroin was bad enough, but fentanyl is much worse. And how do you protect your children from getting products that have fentanyl in them? And that, of course, is the major obstacle. Children and grandchildren and great-grandchildren. Well, let's go to the next one. We haven't come up with a way to deal with that. This is an interesting problem of new. This is a fertility clinic that's under fire for transferring an embryo with a cancer gene. The question is, how do you know that the embryo has a positive gene if nobody tells you? And so this suggests that the fertility clinics need to be overseen perhaps more closely. And also, it means that you have to look for cancer genes because if you don't, you wouldn't know that you've transferred an embryo that has a cancer gene. And so somebody's right now suing this fertility clinic because the issue is giving the wrong embryo, but another issue is giving an embryo that has a deadly cancer gene.
Dr. Callender, what field of medicine is that called when you can do some gene editing and find out that an embryo might predispose a baby to cancer?
Well, what actually happens is that you have the sperm donor, and what happened in this case, the sperm donor after donation turned out to have a cancer of the stomach and therefore had the gene. So I guess it wasn't known at the time of donation.
Gotcha.
And we do now have the capacity to test the genes, but apparently that fertility clinic didn't know it at the time. And you know, we talked about these new foods that they're producing, and a lot of things we don't know the downstream effects until we do the wrong thing, and then we learn from it. And this is an example of where the fertility clinics are using these embryos, but one of the things they hadn't considered as much is the fact that they may be giving genes that they weren't aware of at the time the sperm donor gave the donor or the ova or the egg, the sperm or the egg, and the embryo would have the gene from the sperm and the ova that may have a gene. So this means that the embryology studies have to include genetic studies. But sometimes the donors aren't even aware that they have these genes until much later. So this then makes you wonder about the wisdom of doing this. But if you're in a situation where you can't do any better, then sometimes they're willing to take that risk.
And Dr. Callender, also, I have a question about when they're freezing eggs and sperm, do they check them first? I'm sure they should.
Yeah, but you can't check them for every gene there is.
Oh, okay.
So that's why, for example, if you have somebody who's healthy at the time they donate, but then years later develop identify a cancer gene that you didn't know they had, that makes it risky.
Dr. Callender, this sounds like the boys in Brazil. It sounds like
Yeah.
Gattaca, where they're, genetic testing, to determine, the best survivors, the most intelligent, the best looking, through genetics. It's a little scary to me.
Yeah, I think we have a lot of work to do to really understand the significance, short and long term, of what we're doing with these fertility treatments. And so this is one example of how things can go wrong.
Is there any government control right now over it?
Not that I know of, and I think that's what's going to happen as a consequence of this case. Okay, let's go to the next one. Well, we have all kinds of infections, and now we have a fungus among us that is spreading, and it's a drug-resistant fungus. Candida auris is a fungal infection that has been responsible for 4 deaths, which is a relatively small number, but it beats 0. And it's a relatively new fungus, so it is of concern. And I guess the greatest concern is that medication to successfully treat it is not well known, because it's often fungicidal resistant. And since it is now colonized on the skin, it can, especially to the immunosuppressed person, become capable of making them sick. 1/3 of people who become sick with the fungus die, which is frightening.
Mhm.
It's not much we can do about it. But it's something that your doctor needs to be aware of. Well, it seems a small number. 1 is already too many. I guess the bottom line is that keeping things clean becomes even more important, especially when you have invasive procedures, catheterizations, intravenous medications and so forth. And so MRSA was a big problem, remains to be so. And now we have a fungus that fits in the same category. So cleanliness next to godliness is still something that pervades us all. This is this article on the same fungus. So it's something that your doctor needs to be aware of.
You know, so you go grocery shopping and you pick up some fruit or some vegetables off the shelf, you know, that may have been handled by somebody else. Can you kill it by washing? I mean, you know, gracious.
Well, that's the only thing you can do anyway. That's the only thing you can do because most people are not going to be susceptible to it, but the immunosuppressed person could be. So the bottom line is, yeah, the best you can do is to clean it off anyway.
They're gonna start banning.
What's that?
They're gonna start banning people who are immunosuppressed from getting jobs.
I haven't seen anything like that yet. Are you suggesting that should happen?
I'm suggesting that after seeing this article, you can't work by the fruits and vegetables.
Why not? You mean if you're immunosuppressed, you have to wear appropriate protection. But even then, I don't think anybody would keep them having a job, but you would let them know that if you're immunosuppressed, the risk of infection is greater, which is correct. And so the importance of hand washing and keeping things clean becomes even more important.
Mhm.
That's it.
Okay, any other topics that you think we should discuss? I think the topic that is going to become the source of discussion for the next month or so is going to be the United Network of Organ Sharing and the sharing of livers. And that is managed by the Secretary of Health. And I think over the next month or so, we're going to see complete overhauling of that, of UNOS, and a competitive bidding for the organ transplant procurement transplant network, the OPTN, which was created to systemically have a system, put in place a system that actually does the ideal job for this. Elizabeth, you had a comment?
Yes. Again, good morning, everyone. Good morning, Dr. Callender. I like to revisit when we were talking about medication for kids. I have a child that's over 50 years old. And during that time, she was a daydreamer. And we moved around a lot. Every 2 years, we were in a new city. And so one doctor suggested some medication, and my mother was always a component of preventive. And so when got to another city, I wouldn't give her the medication. I got to another city and met a wonderful doctor that worked with me. And the first thing, and that was before I got into, before I got totally into becoming a wellness coach. He says, let's review her diet. And so I I lived at the library for several days, reviewing a lot of stuff. And the first thing I eliminated was no Kool-Aid in my house because of the red dye that affected kids' learning. And from then on, I started investigating a lot of things and researching a lot of things. And that was the key for my child.
Very, very interesting.
We
Any other
had
comment?
we had also last week or the week before, care for us that we over medicate us as we get to become seniors, and unless the doctor actually analyze it. And I know several of us have said that with our elderly parents, and now they were becoming elderly, sometimes some doctors are prescribing too many drugs or too much for our systems. And we also have to be aware that sometimes we become overly medicated.
Dr. Callender, I have an article, maybe we've talked about it before, but it was interesting to me. I would like to share that.
Go ahead.
Can you see it?
Yes.
Mm-hmm. Sleep affects your immunity after vaccination.
It's interesting that there's an article also that talks about sleeping less than 6 hours before you get the shot limits your ability to fight off to let the vaccine be effective. So that good sleep is good for everything. And they talk about 6 hours of sleep, although the desired time is 7 to 9 hours. But if you have less than 6 hours of sleep, they point out that this had a negative impact upon your ability for the vaccine to be effective. Of course, nobody would ask, would limit your ability to get the vaccine because you didn't get a good night's sleep. But this is some data that's developed after all of this was done. But of course, I think the fact is that we know that our brain thrives while we sleep and repairs itself while we sleep. And when we don't get enough sleep, this affects our whole body, but especially the brain. There are many studies on sleep that talk about the different components of sleep. And there's little question that it also heightens the immune system as well. And it's also important to appreciate that this affects whatever vaccine you have, whether it's the flu vaccine or the hepatitis vaccine or the COVID vaccine or whatever. So. But no matter how we talk about the importance of sleep, there's still some people who just thrive with 5 hours of sleep. Some people do poorly with 5 hours of sleep, but some people thrive with 5 hours of sleep. But medically speaking, 7 to 9 hours is the goal.
Like med school students.
Well, I think med school students never sleep more than 4 to 5 hours a night, but that doesn't mean they're doing the right thing. It's amazing that that we survive some of those unhealthy practices that we developed while in medical school.
You know, this surprised me here, Dr. Callender, with this. I used to think that REM sleep was good for you, and now it's saying it's bad.
Yeah, that's what it's saying. But it says that missing REM sleep is a problem.
Yes.
So the flip side of that is the more you dream, generally, the more you recall your dreams. So if you remember your dreams, you're in a good health situation. If you never remember your dreams, you're not getting REM sleep.
Mhm.
And the more REM sleep you have, the better off you are.
John Buchanan had a question for me about are pears good? The fruit pears, yeah, they're great. They're good for digestion. They contain copper that helps your immune system, nerve function, potassium that helps heart function and muscle contractions, folate that's necessary for cellular function, vitamin C, vitamin K that's necessary for blood clotting and bone growth, promotes bone health. Um, they have low glycemic index, so they don't increase your blood sugar, improves your heart health, benefits your skin, makes your skin smoother. So pears are all good, just never eat them out of the can because then they're loaded with sugar.
Mm.
Any other comments or questions?
Dr. Callender, I wanted to share the article, the MOTEP newsletter.
Okay. Yeah, in this article, this newsletter, we talk about a number of things, including our blood donation experience that John had. You want to show that off?
Okay, I would.
Oh, look at John.
Mm.
Let's see the rest of it, John. As he celebrates his 100th donation. Can you imagine 100 donations? That's kind of remarkable.
Mm.
I'm up to 105 now.
Wow, it's amazing.
Mhm.
Donor Hall of Fame. How about that? That's an amazing accomplishment.
Mhm.
Yeah, congratulations, John.
Thank you for your donations.
Yes.
You don't know, we don't know how many lives you've saved.
Mm.
Right.
I'm glad I have all positive blood.
Yeah, that's a great, you have no idea how often that becomes important when you have people who have trauma and have accidents, and they would die if they didn't get blood transfusion. And we sometimes don't appreciate the enormity of blood donors. So we have an opportunity to have a hero in our midst. Well, we have a couple of heroes. We have a number of heroes. We got the genius of Darryl Armistead. We got John Buchanan. We got the great John Tatum, who's heading to his 30th year after a liver transplant. And the great Carol Tatum, who allowed it to happen. So got a lot of heroes in,
Like I had
in our
control.
midst. I mean, Carol is an angel of mercy. She's helping people everywhere. She's made this group possible. And so close your mouth and your eyes and take it and say thank you, Carol. We recognize that you are a great person and an angel of mercy that God has sent to us, and we thank him for you.
And the great Clive Callender, who's performed several hundred kidney transplants and also weighed in on a whole lot of liver transplants and others.
Yeah, we've all been blessed, haven't we? Yes, we have. Okay, and we have some other